Welcome to the CUGH Faculty Development Webinar Series, Teaching Global Health through an Interprofessional Lens. My name is Jessica Everett, and I'm Executive Director of Child Family Health International. It's my honor to be moderating this session and this webinar series. The goal of this series is to provide faculty, staff, administrators, and student leaders with content in order to teach global health through a truly interprofessional lens. Global health can be a challenging topic and field because it requires us to go beyond our traditional disciplines and grasp, understand, collaborate with many other disciplines. In order to do this, we want to lay a foundational knowledge so we can teach and understand where our fellow disciplines and colleagues are coming from. This webinar series is sponsored by Child Family Health International and facilitated by the Consortium of Universities for Global Health. This is the third part in a six-part series. We have had global health and law, global health and anthropology, and global health and engineering. CUGH is a leader in institutions that are involved in academic global health service, practice, research, and education. CUGH has membership for both institutions and individuals, as well as a multitude of programming that are open source. There's a sliding scale for membership fees for those from low and middle income countries. And I invite you to visit www.cugh.org to learn more about webinars and membership. The CUGH conference is also coming up in Washington, D.C. in April. And if you enjoy this webinar, the conference is a wonderful next step to expanding your global health understanding and network. I want to point out where you can find the prior webinars, which have been amazing. Dr. Peter Brown from Emory University did Global Health and Anthropology. Dr. Virginia Rawshorn from University of Maryland did Global Health and Law. These can be found by going to the CUGH homepage and going to About. Under About, go to Events. Under Events, go to Past Events. You will see a variety of webinar recordings and programming available there. We hope you will visit these webinars and use them in your classes, as well as distribute them among your like-minded colleagues. As I mentioned, this webinar series is sponsored by Child Family Health International. Child Family Health International is an institutional member of Consortium of Universities for Global Health. We're a nonprofit organization that provides global health education programs for undergraduate, graduate, and postgraduate trainees that are either faculty-led or non-faculty-led. Please visit www.cfhi.org to learn more. This webinar series was inspired by a 2015 article that was published in the Annals of Global Health. The Competency Subcommittee, which I'm currently chairing, was formerly chaired by Dr. Linda Wilson from University of Alabama, Birmingham. Linda led the way for this seminal article, which helped to define both proficiency levels in global health, as well as global health competencies for 2 of 5 proficiency levels. This is an open source article. The URL is at the bottom. You can also Google it. And I hope you will check it out because it does lay some important competencies that all learners, regardless of discipline, can benefit from. I want to introduce an amazing woman and our speaker today. Dr. Shannon Marquez crosses fields between engineering and public health. She's truly a woman of many hats, but also a unique professional who has an appreciation both professionally and personally and in practice of both public health and engineering. She's known as a public health engineer. She serves as the Associate Vice Provost for Global Health and International Development at Drexel University. She's also on the CUGH Board of Directors.
Good afternoon. I hope you can hear me. It's a pleasure to be here today to speak on a topic that's very near and dear to my heart, global health and engineering. As Dr. Everett mentioned, I do have a background spanning both engineering and then I went on to public health school as well. And I hope today we'll have the opportunity then to really explore this topic and perhaps give you some tools and information that might improve your interprofessional approach to global health education. So I'm going to give a little bit of background on the field and then speak a bit on some key terms for understanding this intersection of global health and engineering and some key examples of engineering in global health. Finally, we'll conclude and have some time for questions and or discussion, as was mentioned by our moderator. Some key objectives for this session then are to be able to define engineering as it relates to global health, also giving examples of engineering applied and within the context of global health interventions, and finally, describing the interprofessional and workforce development needs. So what is engineering? Oftentimes we hear this term, and as we begin to think about it, engineering is really an application of scientific knowledge, solving problems, designing and building things in the real world, and it's really the ability to solve complex problems and implement these solutions and designs into a cost-effective and practical way, bringing it into reality. So engineers are considered problem solvers. They are organizers, they are communicators, they're calculators, they're designers, and it's about using that science and math to solve problems. Now, there are many, many branches and fields within the various engineering disciplines. However, all of the engineering degrees are based on one or a combination of the four major disciplines, the four classical disciplines: mechanical, electrical, chemical, and civil engineering. I'll talk a little bit more about that later in this webinar. Now, engineering education in the U.S. and really abroad now is really dedicated to educating students to be professionals, to really practice engineering. And ABET, or the Engineering Accreditation Commission, is a professional body dedicated to accreditation and regulation of professional development in the engineering professions. There are about 35 member societies that provide expertise to help set the ABET standards for accreditation processes. So these education standards really serve as the basis of quality against which professional engineers are held for licensure. And engineering programs, therefore, really align their curricula with these ABET standards and prepare students for licensure. Practicing engineering with a company or firm, you don't necessarily need a professional engineering license. However, if you want to design and be an engineer on your own in your own consulting practice, you do need that professional engineering license. So most engineering curricula actually have very similar core requirements because of these ABET accreditation standards. ABET accredits approximately 3,700 programs and 750 colleges around the world. As I mentioned, the PE license, or professional engineering license, is the engineering profession's highest standard of competence. It's a symbol of achievement. And just as a CPA defines the accountant and a law license defines a lawyer, the PE license really tells you that an engineer has mastered critical elements of the profession. It generally requires a certain number of years of experience, particularly with design work, in addition to passing a series of examinations within the discipline. The first step toward professional engineering licensing, therefore, is receiving the engineering in training designation. And that's the first step that is usually accessible to students as they're finishing their engineering program. So this intersection of global health and engineering is very interesting. We obviously know that there's a need for professionals who can provide sustainable solutions and resilient infrastructure to help alleviate poverty and address global health challenges. And so engineers are particularly needed to work in this global context with the skills and understanding to address these global health challenges and international development in general. Engineers can help with understanding of infrastructure design. delivery processes, particularly in resource-limited settings and low and middle income settings. And they can also assist with the mobilization of technical expertise to implement interventions addressing global health challenges, such as natural and environmental disasters, food security, water and sanitation and hygiene, energy, housing, disease outbreaks, etc. Bernard Amadei is a very interesting engineer who really began many years ago focusing in this area, this intersection. A quote from him: "The world doesn't need any more big dams. The world needs clean water, energy, and basic services for the billions struggling just to stay alive at the end of each day." And I thought this quote really epitomizes this intersection. Dr. Amadei went on to found Engineers Without Borders, which is an organization that you might have heard of. There are chapters across the country, and I'll talk a bit more about that. But then also went on to found or co-found the Mortensen Center for Engineering and Developing Communities, which has really been committed to training engineers for working on these development challenges. And finally, he's a published author. One of his seminal texts is Engineering for Sustainable Human Development, really acknowledging this connection to using skills and competencies of engineers to address these global challenges. And most are really within the health sector, so global health challenges. Back to Engineers Without Borders, it's very interesting to see how this has evolved over time. Starting in 2002, when Dr. Amadei founded this, it's really been a way to connect engineers and engineering students to the developing community, and has a particular goal in training leaders to understand these unique challenges. And from the very beginning, this interprofessional approach has really been quite successful. That's a snapshot of the national webpage. The mission of the organization has consistently been to support community-driven development programs worldwide with partners implementing sustainable projects. Many of these projects, as I mentioned, have far-reaching implications to health and development in general. And the communities that they serve, they're really committed to helping to build capacity and helping to have sustainable solutions to address these basic human needs. I have found it really exciting to be engaged with Engineers Without Borders as a professional. There are chapters for professionals as well as college campuses around the country. There are also international Engineers Without Borders organizations as well. And so, as you can see, it's really exciting to see how this interprofessional approach, actually from the engineering side, has been thriving. Engineers Without Borders, as an example, includes professionals, engineers, and non-engineers. And that's just a snapshot from the local Philadelphia professional chapter, which recently wrapped up a health project in Rwanda. So back to this broader topic of the intersection of global health and engineering, I thought we could shift gears and talk a bit about some examples by discipline to really help us synthesize and understand how each of these areas can contribute significantly, particularly in global health. So mechanical engineering, which is really one of the broadest engineering disciplines. Mechanical engineers design, develop, build, and test mechanical and thermal sensors, materials, and devices, including tools, engines, and machines. My first degree is actually in mechanical engineering, and I actually had a strong interest in engineering even in high school. And as I went through college, I really was excited about the idea of being engaged in designing mechanical devices. From the perspective of global health, some of the most critical interventions have really been helping us connect sort of this mechanical or thermal entities with improvements in interventions. Here is an example of the passive vaccine storage device that was funded by Global Good, which is also a collaborative with Bill Gates and the Gates Foundation, and it's an insulated container that extends vaccination services in developing countries. As you know, the cold chain storage is a real challenge in delivering immunizations in low and middle income countries. And so this system is designed to keep vaccines at the appropriate temperature for a month or more with repeat vaccine retrievals and no need for electricity. Also built into this system are sensors and SMS capabilities so that health officials can keep track of the thermos's location, interior temperature, exterior temperature, how long it's been open, and for how long, for example. Electrical engineering then, electrical engineers focus on designing and developing new electrical equipment and solve problems and test equipment. It deals with electricity as well as electromagnetism and electronics. So electrical engineers work with all kinds of electronic devices, from the smallest pocket devices to the largest supercomputers, and in the telecommunications industry, which it's in telecommunications, particularly in mHealth, that we see this intersection of the electrical engineer with global health practitioners. As we know, mHealth has proven to really be an intervention that can help really build capacity and communicate critical information in remote settings. Here's a technical brief from USAID, which really talks about how mHealth was used to in the response of the Ebola outbreak in West Africa, for example. We know mHealth interventions have been successful all over the world, including in our own country, in helping to shore up and improve health system strengthening and the continuity of care. Chemical engineering is sort of this third classical discipline, and chemical engineering deals with chemical production and the manufacture of products through chemical and biological processes. So chemical engineers apply the principles of chemistry, biology, physics, and math to solve problems that involve the production or use of many chemicals, fuel, drugs, food, and many other products. It should be noted that chemical engineers, although it's called chemical engineering, biological engineering processes, biomedicine, and pharmaceuticals are actually related to the discipline. In fact, in the example I'll provide today, we can see how the skills in chemical engineering have been used in the pharmaceutical industry for a very long time, particularly in the manufacturing side. Here's a snapshot of a recent intervention that has improved the manufacture of vaccines, really getting vaccines produced faster. And as we know in global health, this could be critical to solving some unique challenges, particularly with epidemics on the rise and certain unique health endpoints. And finally, that fourth classical discipline would be civil engineering. Civil engineering is one of the oldest engineering disciplines. I think Imhotep is considered the oldest engineer, the first acknowledged civil engineer. It deals with the built environment, including the design, construction, and maintenance of the physical and naturally built environment, including works like roads, bridges, canals, dams, and even buildings, and as well as engineering for air pollution, water resource management, water and wastewater treatment. And many of these areas related to environment and health are often coined public health engineering. If you look at the diagram here, then we note that civil engineering really relates to a broad array of disciplines, from environment to urban planning, to transportation, to structures, and even water resources. I have a background in civil engineering as well as mechanical engineering and environmental engineering, and it's been exciting to really bring this all together in my current work, which is very applied in global health. And so I thought I'd take a little time to talk about how this intersection has come together to address a critical global health need, and it leverages having a background and skill set in engineering, and that is really addressing the global water sanitation and hygiene crisis. We have had a very innovative partnership with World Vision Water, and in that partnership we've developed a training program that's interprofessional and allows students to really get global health field experience working side by side with civil engineers and other water engineer and global health professionals addressing the global water crisis. We obviously know there's a great need to provide such intervention and improve health in many communities that have limited access to not only water and sanitation. So this framework is interprofessional in that it's cross-cutting. We're focused on global water challenges, but it intersects with the health and education and even food security and economic development sectors. We are working in about 25 different countries across sub-Saharan Africa, and students from all backgrounds and disciplines, including engineering, public health, medicine, global studies, mathematics, liberal arts, have the opportunity to spend 3 to 6 months working in the field. About 20 students per year are funded through this program, and it's been quite successful. As noted on this slide, we've had a large number of students from the College of Engineering as well as the School of Biomedical Engineering. But then in addition, these traditional areas that we see students from global health, like public health and medicine and nursing and health professions. So it's been interesting to have all of these students training side by side and culminating in an activity that allows them to be in the field working in global health and international development, as I mentioned, for 3 to 6 months. So much of the activity around this really provides a wonderful example of why this interprofessional lens and the focus on how engineering as a discipline has contributed to this particular global health challenge, and that is the global water crisis. So we know that the global water crisis is multidimensional. We're often faced with wondering, if water is clean enough, is it hurting us? Is there enough for all uses and the multi-use of water and the demands of that? How much is there? Is there too little? Is there too much in terms of flooding versus water scarcity? In addition, though, equity, are we being equitable? And when we look at equity and how we design these interventions and deliver improved water and sanitation services. Also, if it's hurting other ecological species, and do we have enough data in general? We know from the global health perspective, the critical health issue is that someone in the world dies from a water-related problem about every 20 seconds, according to the UN. And that even as we solve other major health challenges in the world, such as addressing HIV/AIDS, with providing ARV drugs, that if we are still sending individuals home without access to adequate water and sanitation, we still have very unhealthy communities, particularly in the under 5 population. And a major problem that's really not talked about as much is this connection to sanitation and the interventions that need to be in place to address that side of the issue. So the problem is inadequate drinking water and sanitation and hygiene promotion, which is the software needed. Hygiene promotion and education to ensure that individuals improve their behaviors to address and improve health outcomes. On the sanitation side of the equation, still nearly 2.4 billion people worldwide do not have access to improved sanitation, and it translates into many people in the world still practicing open defecation, which is a significant challenge in addressing water, sanitation, and hygiene. So the reality is, from an engineering perspective, really bringing people up the sanitation ladder, improving sanitation facilities, whether it's a toilet or latrine, to a piped sewer system or a septic tank or a pit latrine. I'll show you a little later in this talk how a simple engineering intervention like that has a huge impact on improving health outcomes. And moving people from open defecation to an improved sanitation facility and ultimately to a toilet or latrine is the ultimate goal. And the engineering required to do that, it's really not as challenging as one may think, but the reality is it's desperately needed still even now. So the contribution from an engineering approach on how this can impact the other areas of water and sanitation, if you really think about it, and this is just data and information from the World Health Organization and World Vision, ultimately WASH improvements can really address diarrheal disease as well as reducing chronic malnutrition as well as addressing food security and allowing communities to grow more vegetables and reducing hunger just by having access to safe water. We also know that absenteeism and educational outcomes can be impacted by improving access to water and sanitation, particularly for girl children who have limited access to sanitation, as well as resources for menstrual hygiene management in the school setting, and then just overall well-being, that improving the livelihoods of communities means improving the access to safe water and sanitation. And so the engineering approach to this, or the contribution of engineering to addressing this, is critical, in addition to all the other disciplines that help support developing such global health interventions. So obviously the need is improving access to safe water, but also the infrastructure, particularly with regard to drilling wells, developing reservoir systems, as well as building sanitation facilities, whether it be latrines or toilets or septic systems. Some of the software and other elements that are needed where engineers can play a key role in translating what the infrastructure needs are is in the development of water committees or management committees that the community becomes engaged in, as well as helping to plan out overall wells and water points in communities or areas to ensure that there are opportunities for the sustainable use and multi-uses available, as well as maintenance and supporting communities in sustainable maintenance of these facilities. So when you look at the water and sanitation hygiene issue, particularly, we can see this intersection very clearly. We understand that engineering approaches are needed because improvements at the household level or point of use or improved well and pump designs or latrines are critical. But we also realize that this intersection requires many other disciplines and backgrounds to help us understand the social cultural implications for successful community-based or bottom-up approaches, such as community-led total sanitation and the needs for triggering in communities, or even designing for behavior change, or finally helping us to understand how to make these interventions more sustainable through policies, reducing costs, private sector and public sector engagement, as well as training and capacity building in general. And I like to show this slide, which is really very interesting. Patil et al. Really shows how this causal pathway of water, sanitation, and hygiene interventions impact overall improved health. And if you see here where I put the circle around, just simply increasing toilets, which would reduce open defecation, and how it relates then to removing feces from the environment, reducing enteric pathogens in soil and overall contamination, and ultimately reducing diarrheal disease and parasitic infections, anemia, and improving weight, height, and nutrition. So the role of the engineering on the intervention here really is the infrastructure. It requires innovation, some low-cost, low-technology solutions that are sustainable, and how to train and translate that to communities to also come up with community-based solutions that may be locally driven through local markets, for example. So the engineer's contribution to this and the overall global health intervention, it's important to see that interprofessional connection. Other emerging issues, as I begin to conclude and we transition to having some dialogue and questions, really are related to then, again, how do we also look at equality and the inequality, particularly with regard to gender and income lines of services, this nexus between water and food and the energy crisis. Engineers will play a critical role in helping to find sustainable solutions, addressing that nexus. Obviously, urbanization is a critical global health challenge, and the need for engineers to help focus on not only infrastructure issues with regard to water and sanitation, clean air, but also housing in general, really the built environment. Finally, in general, there's an acknowledgement that connecting public health, medical, engineering, and water professionals and this interprofessional approach from the beginning is something that would make these type of global interventions more successful in general. And then the impact of climate change is going to require collaboration across many disciplines, and engineers can play an important role in that as well. So I leave you with that point, and at this point we can open the floor for questions and discussion.
Thank you, Dr. Marquez. I want to invite our attendees to ask questions in the question box on the right-hand control panel. If you could type those in and then mention where the institution or location you are affiliated with. Shannon, I have a question. I'm wondering, it's interesting that slide with the sanitation kind of cause and effect. What struck me is that many people coming from a clinical stance think upstream, and it strikes me that from the engineering perspective, you're thinking more downstream. And I wondered if you would comment on how that thinking can either be more productive or more challenging in global settings. I can't hear your audio right now. Might be.
There we go. I think that's better. Okay. Thank you for your question.
Thank you.
It's a very interesting question because, in particular, I think that as we look at these sort of global challenges, and in particular water and sanitation is one that tends to get overlooked. The reality is that there's still quite a bit of work that can be done with regard to increasing the efficiency and the opportunity to create, the better toilet or better sanitation in these communities. And the impact, as you see on that chart, that has on the efficiency and removal of feces or contamination from the environment, and the overall improvement and impact on the health outcome. Ultimately, we know that, many times there are failures in these types of projects, water projects all the time. And a lot of times it relates to the disconnect between using appropriate technology or also understanding what the community's role can be in the maintenance and sustainability of that infrastructure. And so I think the engineers and the lens that an engineer can provide is to really break this down in a systematic way to ensure that we're looking at reasonable solutions, viable solutions that can really have a huge impact on this overall pathway.
Thank you. Yeah, you see a lot of development projects gone bad where latrines become storage closets, or water wells that are instituted with as playgrounds become obsolete and broken down and detracting from more sustainable local sources. I guess, how do you help your students and other colleagues kind of think about testing or piloting projects to look at uptake and cultural and other logistical acceptance locally?
Right. Well, any type of water development project, and I'm glad we're using water as sort of an example of this interprofessional connection because it's really relevant. All of our students and the projects we're engaged in have lots of community engagement, community involvement. In fact, oftentimes they are community-led. So the best example of really evaluating an intervention is at that ground level, ensuring that the technology itself is practical and can be used. And this also helps us address some of these issues with regard to equity, particularly along gender mainstreaming. We find that the burden is disproportionate for women and young girls, and in fact, if you think about many communities that are challenged with access to safe water and sanitation, engaging the women is critical to ensure that whatever intervention comes into play will be something that's actually sustainable and something that can be used. So there's a lot to be learned from the community, particularly from women in the community. Secondly, I think it's important to understand that these solutions have to be low cost to be sustainable. There's a lot of discussion around the role of subsidies and how subsidized interventions can be more sustainable, but engaging the community from the very beginning is critical. Ultimately, it's important to understand that all of these programs have to be evaluated, and evaluating them across the full spectrum. So ensuring that we're working across disciplines to ensure that we have the software as well, that we have individuals who can really look and engage communities to ensure that there are behavior change models in play, and then also evaluate whether or not there has been an implication in terms of improving overall health and well-being, whether it's self-reported or actually looking at local health center data.
Great, and that's really important, that self-reported or observational versus actual, end outcomes data, and certainly an opportunity for public health, clinical folks, and engineers to collaborate on outcomes and impact. Our next question comes from Stephen Alt. Stephen asks, for public health and engineering students who cannot easily travel outside the U.S. for learning abroad, what parallel of similar activities can be shown or demonstrated to students, quote, in the field in local environments?
Great question, Stephen. And I always like to point out that many of these development challenges with regard to water and sanitation in particular are challenges in our own country. In rural areas, oftentimes there are communities that are fed entirely by private wells, and landowners may not have the experience to understand what some of the water quality issues that may emerge. We also know that there are communities in many underserved areas, such as the Mississippi Delta or Alaskan Native lands or Native American areas in general, that also may be faced with the same challenges. I myself am from South Texas, where there are many, many communities struggling along the Texas-Mexico border with regard to these very same issues. So I think that there are opportunities and examples to really get students engaged in this types of nexus or type of work relating engineering and development and addressing some global health challenges that impact all of us.
Thank you, Shannon. Our next question comes from Nilofer Hassanzadeh, who is AMSA's Global Health Scholars Program Director and a wonderful advocate for global health education. Her question is, in order to help address issues regarding follow-up on failed projects, do engineers work with local materials that can be used for maintenance as well as teaching locals how to maintain the projects implemented within a community?
Yes, that's a great question. In fact, we see a lot of times, there's a bit of biting one's tongue. I think as an engineer, you are inclined to always seek what you consider the best solution. And oftentimes, when you're looking at a project that has to be community-led or community-engaged, you have to take a step back and help the community identify the most appropriate local material. We see that in community-led total sanitation projects, or also in agricultural projects where you have to use local materials to ensure that the project is sustainable. It may not be the most efficient use of materials from a design standpoint. The quality of the design may not meet the standards that you might be used to in your own workplace or setting. But what's important is that because it's community-led and sourced locally, it's more sustainable and more technologically appropriate. So anyone who's going to work in this type of development engineering really needs to have the sentiment that working with the community entails being innovative in using locally sourced materials, but also providing the training to ensure that there's true capacity building. It does not make a lot of sense to always have to ship engineers in. Ultimately, training technicians and others to help sustain and maintain these systems is also critical.
Great. So Shannon, what I'm hearing you say is that there's really sometimes more of an emphasis on sustainability and realism rather than things that maybe look as sleek or as traditional as we're used to in our frame of reference. That's a really important point. Next question from Amy Bilton at University of Toronto. How do you define impact in your work, and how might it differ than other research? And how do you balance the needs of a traditional academic environment?
So the first question in terms of measuring impact, so in my work in particular, there are lots of metrics. One of them is looking at the number of beneficiaries or the number of individuals that can be served by a project. In this case, we're talking about a water and sanitation project. The second would be even the cost per beneficiary. So how much does it cost to bring water to that community? And again, as you're beginning to think about that transition of making a project more sustainable in the community, you want to be concerned about the overall costs. The balance with the traditional, what was the second question again, Jessica?
The traditional academic environment, so perhaps regarding silos and traditional kind of academic investigation that aren't as interdisciplinary as what you're calling for.
Yeah, I've often found that a challenge. I myself am a fish out of water. I'm the only engineer with a faculty position in the School of Public Health. But I think the thing that has helped me stay grounded and help this work really advance is ensuring that those interprofessional connections exist. So one of the reasons why I landed in public health and not solely in engineering is because I appreciated that perspective. I think the thing that makes this successful is on the engineering standpoint, I think my colleagues and even myself for many years have spent a lot of time creating programs and projects, solving problems, coming up with technological solutions. But I wanted to carry that a bit further and look at the health impact and measure that impact. And then that requires then me to have some grounding and understanding in the core disciplines in public health, but also to collaborate with colleagues in epidemiology, for example, who could really take it to that next level. And so I think that is sort of the non-traditional engagement that this entails. We see that emerging in other areas. As you look at urban health challenges and the built environment, the same thing. We're seeing architects and engineers and epidemiologists working side by side to address these challenges. And so it's exciting to see how this cross-disciplinary interprofessional approach has really begun to succeed. And we know that we're going to need these approaches in addressing any type of global challenge in the future.
Thank you. And I'm wondering, when you're talking about these interdisciplinary programs and evaluation, the cost and the real price tag in terms of time and funding and potentially travel has to come into play. So one of the things we see in global health is things that are done somewhat hastily, either because we have time constraints due to our programs or other things, or because budgets are so limited. So what is your experience on what this actually costs to do a really good community-based engineering, public health intervention, and then to also evaluate it rigorously?
Great question. I have to say that we've been in a unique situation with a partner NGO that has a model that's slightly different than most international development organizations. First of all, it's multi-sectorial. So at the same time, we are working on water development projects. In those same locations, they are working on education, health, economic development programs, and there are different layers. The second thing that I think speaks to your question of the investment, most of the times these interventions are rolled out in an integrated way across sectors in area development programs where there's an investment of 10 to 25, 30 years of time, where there's an investment in hiring and engaging local people to be part of the overall intervention. And that's what makes it more successful. Admittedly, I think it's very hard to put your finger on how one could succeed without such an approach, because you have to figure out how much you are going to invest and how long you're going to be there. And if you have a short horizon, you can't really see the ROI. So in this case, these projects are actually implemented in area development programs where there's local engagement and a presence of 10 to 25 years. And over time, these interventions are implemented in an integrated fashion. And that's a pretty unique but very successful model.
That's really helpful. I think many times in global health we have really short time frames, even a month or 2 months, particularly for student experiences. So understanding that time frame and thinking about how we can integrate students into longitudinal existing work, I think is really helpful, rather than expecting students to come up with novel interventions and impact analysis within a very short period of time. Another question from Stephen Alt. Oh, sorry, go ahead.
Oh, no, just to add, and with regard to then how we provide opportunities for students, that's exactly right. The programs are not student-initiated, they're existing projects. And the other thing we're committed to is we have a pretty intensive pre-departure training that spans 3 to 4 months before a student is placed in the field, so that when they're there, they're ready for prime time, because this work requires constant implementation. It's not work set aside just for a student. It's real interventions that are being done by an implementing agency. So that means that our commitment is that when we put a student in the field, they're ready to hit the ground running.
Excellent. That's very helpful, and hopefully the paradigm is shifting to recognize that complete student independent initiative is maybe not aligned with the competencies in global health of partnership and collaboration. Stephen Alt has another question. Could you recommend 2 or 3 networks serving to improve dialogue and exchange of experience between public health, global health, public health, and engineering academics or professionals?
Sure. I think one other area is the associations of schools and programs in public health in the environmental and occupational health work group or council. You will find embedded in that particular group engineers who are really at the forefront of this nexus or intersection of global health and engineering. Most of the societies in engineering, particularly related to these traditional disciplines, as I mentioned, chemical, mechanical, civil, and electrical, you see increasingly that they have applied work groups or branches related to solving health challenges. I gave a snapshot of just a few, but I think if you look very closely in the associations associated with these disciplines, you'll find that there's usually a subgroup, subcommittee, or work group that's focused on applications in the health sector. And that's a critical area that would be of import as you're beginning to think about sort of this intersection of global health and engineering.
Thank you. We have a question from Changa Dende, knowing that many people in developing countries still use latrines and wells have been promoted as a possible solution for water sources, how can engineering help to ensure that these wells do not become sources of infection?
Oh, that's a very good question. So one of the approaches that we are doing on the projects we're engaged in really requires that communities are engaged in a decision early on that in order to go to the next level with regard to improvements on the water side, they have to have a commitment to hygiene promotion, behavior change, and some sort of community-led sanitation campaign that ensures that there is some acknowledgement to the potential of implications of not addressing sanitation and the impact it would have on the improved water source. What we find then is when it's community-led and when there's acknowledgement and even support from the community, so oftentimes in many of the areas we're working with in Africa and sub-Saharan Africa, you find that through triggering of the community, helping them to acknowledge that these poor sanitation practices have impacted health, it impacted even water supplies. Once the local leadership gets engaged, such as the chiefs, and provides local incentives, such as even fines and 100% coverage, ensuring that every household must create a locally developed and locally sourced latrine, and that individuals must receive the support of the community to help that happen. Once you have that type of acknowledgement, the program becomes much more successful. So we've learned over the years that you must have one in order to have the other. And in this case, you cannot move forward with addressing access to safe water and improving water sources without acknowledging and having the community take some ownership of addressing the sanitation challenges of that community.
Great. And speaking to that, can you talk a little bit about capacity building in country so that, and is the nexus between public health and engineering something that is a recognized field internationally? How is capacity building and human resource happening in low and middle income countries so these projects can have the expertise locally to do what currently many people from high income countries are doing?
Excellent question, and something I had mentioned. So we happen to be engaged in this particular area on many fronts. One program I did not mention is our capacity building program, where we are actually delivering continuing education and training in global health to across these same 25 countries to field workers in World Vision and other NGOs. What we found is, one, the capacity building need is tremendous. There's a need to really get more individuals in the pipeline, but we also see the same thing that we see in our country, that this is a very unique area of emphasis that's at the nexus or the intersection between health and engineering. And so many individuals who have a classical training actually don't have much of an appreciation to how the engineering intervention addresses a health challenge. So we are actually providing that cross-training by delivering a online certificate program to these international development NGO workers across these 25 countries. We are actually starting our fourth cohort. We just started our fourth cohort last month in January. And just within the WASH sector that we have identified across these 25 countries, about 500 to 600 workers who need this training. Secondly, there is an intentional initiative to increase the access to these types of opportunities for more women and young girls. Again, in the STEM fields in our country, we see the very same thing. But in this case, because the burden of having access to safe water and the implications are disproportionately on women and young girls, it's critical to understand how we might increase the opportunity for getting women engaged. And that doesn't necessarily mean only coming up with formal educational opportunities. What we found is through gender mainstreaming and including women also in being engaged with water committees, taking leadership roles in using local materials to help advance water projects and helping them receive training for maintenance and operation. This is another way that capacity is being built.
Thank you. And for those that are joining us that may not be familiar with the term gender mainstreaming, can you just explore that a little further?
Oh, that is just really providing, in this case, I'm using it in the context of water development projects, where we find that the power structures that are in play generally relate to the social norms. And in this case, usually the heads of villages and households, the voice tends to be male dominated. And however, particularly with regard to access to water and improvements in sanitations, we find that in order for projects to be more successful, there nearly needs to be an opportunity to have more inclusion and more participation from women, to get women engaged. And that starts at a very basic level, from creating safe spaces for women to voice concerns, to also then empowering women to be engaged in leadership roles. And these are initiatives targeted specifically towards engaging women, therefore, and hopefully addressing the imbalance that would exist in advancing any type of project.
Thank you. And then I wonder if you would comment a little bit on your own educational path, and particularly for faculty or trainees that are listening who are either advising others or themselves are interested in pursuing this nexus between engineering and public health. Are there certain programs or schools that have well-defined programs, or other suggestions you can make, and any comments on your path that you can share with others?
Absolutely. So I came from a very traditional background in engineering. In fact, I attended a historically black college, Prairie View A&M, where I actually went there because of the strong engineering program. Prairie View is a minority-serving institution and had a long-standing, very successful college in engineering. And I studied mechanical engineering there. Over time, through the honors program there, I was exposed to several different internships each summer, beginning with my freshman year. I worked at AT&T Bell Labs and then went on to General Motors. In my third year, I ended up doing an internship at Texas A&M University, funded by the National Science Foundation, where I began to look at some of the advanced topics related to research and engineering. And it was through that I decided I wanted to go on to graduate school. I took a little bit of a turn in that I landed at Texas A&M after I graduated from Prairie View in a graduate program in mechanical engineering. I was actually admitted to the doctoral program. And shortly after my arrival, my advisor actually took a job elsewhere to be a dean. And there were about 12 of us in his lab that were fledgling, trying to sort out what we were going to do. And it was at that time that I thought, I'm really interested in environmental issues. I was on a NASA-funded project looking at viscoelasticity of materials that went to space, but because my advisor left, it gave me a chance to think about other engineering disciplines. And so I walked across the street and ended up at the civil engineering department, really trying to get closer to looking at water and air pollution challenges. And I ended up pursuing a graduate degree in civil engineering. Ultimately, I realized I was really interested in this interface between health and engineering. And so I left early, having taken a master's in civil engineering from Texas A&M. My master's thesis work looked at bioremediation in the Kenai area of Alaska. And I sort of felt like I was still on the wrong side of the issue, that I needed to see the full continuum. And so I used that master's as a way to apply to a doctoral program, which I felt was a better fit. And I landed at the University of North Carolina, Chapel Hill School of Public Health, where I had the chance to then study toward my doctorate in environmental sciences and engineering, one of only a handful of engineering programs in a school of public health. And so I actually then shifted gears and focused on water issues. My dissertation work looked at comparative risk assessment of disinfection byproducts and pathogens in drinking water. At that time, the US EPA was promulgating new standards with the Safe Water Drinking Act. And so my dissertation work was very closely aligned with that. And after I finished my doctorate, I actually ended up in consulting, helping many municipalities, particularly in the Northeast corridor, address water quality challenges as these new standards were released. And so that was sort of my pathway. Spent about 2 or 3 years in consulting, and ultimately realized that most of the world's water challenges were in low-income countries and in other places in the world. And so I ultimately ended up back in academia and took my first academic position at the University of Iowa, where I started my career and research endeavors looking at global water issues.
Great, thank you. And you said UNC is part of a handful of programs that have public health engineering. Are there any others that come to mind?
Well, at one time, Harvard has had a very good, a strong group, as well as Hopkins. And, you know, that intersection between engineering and public health has existed in our lifetime. You know, when we think about John Snow, for example, and when we think about these issues with water in particular. So I think what you'll find is if you look at public health programs, particularly in environmental and occupational health areas, you will see that there are many engineers or engineering interfaces that exist. And when you look at engineering programs, particularly in civil and environmental or biomedical or even some electrical engineering departments, you will see opportunities for the interaction between the health sector and engineering.
Perfect. Well, Shannon, thank you so much for joining us today and taking the time, and thank you all for your contributions to the questions, discussions, and this movement towards interprofessional global health. Do join us. We'll be announcing the future webinar dates and times. Check out CUGH's website, www.cugh.org. Consider joining. And also thanks to Child Family Health International, www.cfhi.org, for their sponsorship of this series. Take good care.
Thank you.